Hi everyone, my name is Dr. Tara Farr and I am a chiropractor at Brown Family Chiropractic. Today I'd like to talk to you about postnatal care in infants. So we know mom gets achy and sore through pregnancy and she can't wait to deliver, right? That's what I hear all the time when I work on pregnant moms at the end of pregnancy. But let's talk about birth and the process of that and what can happen to infants as they're being born. So there's two methods generally of delivery, right? Vaginal birth or cesarean section. So I'm going to start with vaginal birth. When babies are being born vaginally and ideally head down, they get squeezed through that birth canal and their brain bones or their cranial bones actually overlap when they go through that birth canal and then have to recoil and come out. It's pretty amazing to think of what that body goes through coming out of that birth canal. So that's one little thing that happens. Another thing that happens as they get squeezed through that birth canal is it squeezes all that fluid out of their lungs, and when they pass through, their lungs recoil, and that's how they get their first breath of air into their bodies. So it's a really cool, amazing process, and it's so awesome to see how the body adapts and has learned how to get that in their systems and out of the body. But I want to talk to you a little bit about the effects that can have on infants specifically. You know, I work on 1 day old, 1 week old babies quite frequently, generally sometimes with reflux or colic or constipation issues, but sometimes just for wellness. You know, moms just sometimes bring their kids in for me just to check them and make sure they're good after delivery, because it is a traumatic thing both on mom and on baby. So what can happen is, especially with hospital births and moms are lying on their backs, doctors generally are right-handed and they tend to turn, pull to get the baby's head out of that birth canal. And when you're more dominant on one side, you tend to pull a little bit harder on that side. So what happens is I see a lot of upper neck restrictions or subluxations, as we like to call it in the chiropractic world, that can cause different issues. I see a lot of colic or fussiness or sleep issues when there's misalignment in this upper neck, insomnia in adults, but generally just lack of sleep in kids is contributed to restriction in this upper neck. So making sure that the baby's, well off for life, just making sure their spine is aligned, their nervous system is in balance, is a great healthy way to start the baby off into this world that they're gonna grow and develop in. Other things I see are a few restrictions in the lower back or the sacrum or the tailbone area. That kind of can feed digestion. So if there is some reflux issues or constipation issues, a lot of colic sometimes has digestive issue component to it as well. Balancing that out is a great way to kind of stimulate proper digestion and proper balance in the nervous system. So if you have a newborn baby or have a friend that's going to have a baby, talk to them about maybe looking into getting a chiropractic adjustment, at least to set that foundation of health and set them off for development future on. I can show you how we generally work on newborns. People don't think about chiropractic in newborns. They kind of think it's kind of scary, but it's a very gentle way of getting movement. It's not like I work on an adult. It's very different. But this tool is called an activator. This is an electric activator. And what this does, it sends a little recoil force. You can see that. Said a little bit later. And how I adjust newborns is actually I do it through my thumb, so it's even more gentle. And they don't need a lot of movement to get the movement we need, but just getting that little jolt can help shift everything into place, and babies generally are relaxed. I've had babies fall asleep in my arms when I'm working on them. So it's a very relaxing, calm experience when they get adjusted, and generally they sleep great after an adjustment, so the parents are thanking me a lot after that too, so they can get a little catch-up time. So if you have questions, please comment below. If you are interested about getting your kid in for chiropractic care, give our clinic a call, and I'd be happy to work with you. Have a good day.